Thank you, Mr. Chairman, and thanks to the members of this panel for the work that you've done to help safeguard as many Americans as possible from this terrible infection. Dr. Hahn, you surely speak with pharmaceutical companies and get a sense of what progress they're making on their clinical trials. When do you believe that you'll receive the first application? Is this something that's going to come in the next couple of weeks? Are you getting an indication it might be a couple of months? What kind of timeline are you anticipating before you'll receive your first application?
Senator Romney, thanks for the question. I honestly do not know when we will receive our first application. As I mentioned earlier,
of course not. Of course not. You wouldn't know, but you're speaking with them. You know, are they getting close to the results from the 30,000? Are they just getting going? Is this? Have there been any applications that have been sent to the DSMB? So, is it getting close, or is it going to be a month or two from now?
So, Senator, I cannot speak to confidential commercial information that we have. For the publicly available data, the enrollment is going as expected in these clinical trials, and in the case of one, has exceeded where they expected to be with respect to the 30,000. When they submit an application will be dependent upon when events occur in this trial, including or involving prevention of infection. When those events occur, and at pre-specified time by the DSMB, that's when the first judgment will be made about the maturity of the data. And I can't prejudge that. I don't know.
Yeah, I know you can't predict, but you're getting an indication as to whether they're receiving those things or not. And have any applications been received by the DSMB at this point?
I do not know the answer to that, sir.
They wouldn't let you know that, whether they received an application?
You mean the sponsor, sir?
No, the DSMB.
No, I do not know the answer to that question, sir.
Okay, let's say that tomorrow morning an application is received. How long typically is the process inside the FDA to go from the time you receive an application until you make a determination that, yeah, let's go ahead?
So typically that process can take weeks, sometimes months. It really depends upon the complexity of the data and the data set that we're looking at. We have not made a commitment to the timeline per se because we haven't seen the data and we don't know the complexity of the data or the amount of data that will come our way. What I can tell you, sir, is we do feel the urgency of the moment. We do take very seriously our responsibility to protect American lives. We will not delay, but we will not cut corners in our process.
Okay. Dr. Fauci, I think everybody's very, very pleased with the fact that our government has proceeded with manufacturing vaccines, even though we don't know whether they're going to work or not. And that's so that we'll be able to have vaccines to the American people as soon as possible. If the FDA were to approve an application, let's say on November 1st, how long would it take for the American people to get vaccinated? Maybe I'll change that to say, what proportion of our population, if it were approved on November 1st, what proportion of our population would be able to be vaccinated, let's say, by the end of the year? That's a 2-month period. Yeah. I don't know whether these manufacturing facilities are producing 100 million vaccines right now, or 5 million or 10 million. So is this something that would really just go to a small subset of the population? Yeah. Or could we possibly inoculate the great majority?
No. Well, good question, Senator. The fact is that the production as it is rolling out, and when you hear the numbers, that's the totality of all of the companies. So that in November, you'll probably be, maybe 50 million doses available. By December, maybe another 100 plus million. And then when you get into January, February, by the time you get to April, there'll be a total of about 700 million. So if you're talking about who's going to get vaccinated in December or November, it is not going to be a large proportion of the population. It will be according to what we were discussing before, namely those who are, according to the Advisory Committee on Immunization Practices, getting the priority. Likely will be healthcare providers, and likely will be those who are vulnerable with underlying conditions. I can't say that for certain, but if anything is the past, this prologue, that likely will be the case. But we're not going to have all of the doses available, for example, by the end of December. They will be rolling in as the months go by, and by the time you get to maybe the third or fourth month of the 2021, then you'll have doses for everyone.
Thank you.